Hi everyone, my name is Kat. Welcome to my channel. Today I'm going to be talking about my experience with domperidone. This video is for both Canadians who are taking domperidone and Americans who are taking or would like to be taking domperidone. Domperidone is a dopamine antagonist, so it means that it blocks dopamine receptors in the brain. It works for gastroparesis by blocking the signal from the brain to the gut. And it's used for things like nausea, gastroparesis, vomiting, and to help women lactate. Okay, so here's my experience with the infamous domperidone. I say infamous because it has a black box warning in the US by the FDA, which we'll get into a little bit later. I've been on domperidone for about 5 years, and I got off it about 2 months ago or so. I was put on domperidone as a trial, so this means that I don't actually have a diagnosis of gastroparesis. However, my GI thought that I did have gastroparesis, and he put me on the trial of domperidone to see if it would help with my nausea and my acid reflux. I had food that was just sort of like coming up into my throat, so every time I would eat, and oh my God, I'm actually getting like acid reflux right now. Like as I speak, I can hear myself, I can hear how throaty my voice is, like this, like I can hear it all the time. And this is exactly why I was put on domperidone, because I was having that all the time. It kind of slowly progressed over the years, and I actually did have a pretty severe bout of gastroparesis when I was about 10 years ago. So I was in my mid-20s where I wasn't really hungry, so I just didn't really eat a lot, and I was losing a huge amount of weight, and everybody just thought I had anorexia, including my doctors. So back to my story about getting onto domperidone. So I didn't have any testing done, and I just was put on it as a trial. It's one of the more safer drugs for motility. So my GI thought that I had a motility problem, and I did. I was put on it along with a PPI and Zantac, I think it was, twice a day. So that meant two 10 milligram tablets. So I had one before breakfast and I had one before dinner, and this was supposed to help so that I could actually lay down to go to sleep. Because at this point, I wasn't able to do that. Like I would eat throughout the day and not really eat as much as I needed to maintain a healthy weight. And then I would go to bed and I would just be like, first of all, nauseated, not hungry, and I would feel like I couldn't actually lay down because all the food would just be coming up, like literally into the back of my mouth. Like, I know, sorry, gross, but like that's what would happen. I did still have to adjust the way that I did things after I was on this whole regimen. So I had to cut out things that were acidic, things like chocolate, tomatoes, spicy foods, like just basically anything tasty kind of, but like, you know, just acidic foods. Like I had to take those out. I also had to make sure that I was propped up. So I put a whole bunch of books underneath my mattress and propped myself up along with pillows on top of that, just so that I wasn't like laying flat. And that's how it's been for years. I just can't lay flat unless I have no food in my stomach. Like it's been basically like half a day. Even on the domperidone, I would bend over to tie my shoes or something just after eating, or like shortly after eating, say an hour or two, and food would start coming up again. And that's like what I deal with all the time. On top of that, I had to refrain from eating 3 to 4 hours before I went to bed, and it had to be something small. Eventually, I was able to get off the PPI, but I had to stay on the Zantac with the domperidone. So over the years, slowly, I had to start upping my domperidone. I kind of noticed that things got a lot worse, I would say about, I don't know, 1.5 years, 2 years ago. And then I noticed that I needed like 3 domperidone instead of the 2 domperidone. So I would have one in the morning and then one before my lunch and then one before my dinner. Actually, it took 4 years. So 4 years on the domperidone, and then I had to go up to the 3 a day. So actually I did pretty well for like 4 years. During this time, I wasn't really having any side effects, none that I thought were attributed to domperidone. On the 3 domperidone, I did start feeling a little bit weird. Like I started to feel a little bit more nervous, a little bit more like jittery, like sort of like I had a low dose of caffeine in my system. And then I also started having some tremors. And I like, cause I'm thinking back, I'm thinking that I actually started having tremors quite a couple years ago, because I remember thinking like, oh, it's getting really hard to do my eyeliner. So I would stop doing eyeliner. You know, an eyeliner, like my makeup in general was a big thing that I used to do. So stopping my eyeliner was like a major life event. So then I started noticing like, oh, whoa, okay, this is getting hard. Cause like, and my brows too, I would just be like, oh, okay, I'm kind of shaking. This is weird. So about 2 years ago, I started noticing that when I was lifting weight, I was getting kind of shaky. Like I would put the weight down and then my muscles would be trembling. Actually, it was kind of like during when I was actually lifting the weight, I'd be trembling, but then I'd put the weight down and my muscles would be trembling like I had just lifted a ton of weight, when it would just be like a really, really low weight, like something that I should have been like relatively used to, that I had been doing for a while. And it wasn't like I could just progress. Like I couldn't just progress my weight, because it would just, the trembling would get worse. Like a lot worse. And it would just be like, I'm not making any progress in the gym. Like, what the hell is going on? So I had a hunch that something neurological was happening. By the time I upped my dose to 4 domperidone a day, I was feeling really, really strange at this time. And my whole body was feeling like it had some sort of internal buzzing. And I felt like I was moving in hyper speed. So it was just like anything that I did, and it would sort of like come in episodes, but it would be there like all the time to some degree, and then it would come in episodes. Like I would be like typing on my computer and it would just feel like, even though I was typing like this, it would feel like my whole body was like this. And I was just like, oh God, like what the hell is going on? Or I would be standing at the kitchen and I would be doing like a bunch of dishes and moving around and like cleaning the kitchen, which is fine. Like I normally clean the whole kitchen, do a load of dishes by hand. But like by the end of it, I would just be like, literally like my whole body just like totally tremoring like this, and even my speech could be affected, like how I'm just like So about maybe almost a year ago now, I would say, I was at work and I all of a sudden started to get this like really big feeling of like stress. Like I was stressed, I had a lot of stress going on, but I started to feel really, really jittery, like really, really weird. And I thought that it was my blood sugar. I went to go get a bottle of Gatorade. That's what it was. And I started drinking, but like everything just got like so much worse. Like I was having really severe heart palpitations. I was having like muscle weakness, muscle tremors. Like I was having a lot of trouble standing. I thought like, I just like had this feeling like in sort of like, I want to say like the base of my skull and my spine. I felt like I was gonna collapse. Like I had this, I don't know how to describe it. It's so hard to describe. Like I've had panic attacks before, so it sounds so much like it's a panic attack, but it was not a panic attack. Like my mind was actually not freaking out or racing, and I've had so many panic attacks that I knew this wasn't a panic attack. So I was just like, what the hell is going on? And then my tongue and my jaw and my neck started to seize. Like the tremors got worse in that area, and I couldn't really talk. Like, because I remember I was on the phone. That's right. I had called my mom just to chat with her. And I was like, I don't know what's going on. Like, I don't feel well. And my heart was racing. Like, again, not like a panic attack, like out of fear racing. Like, it was just like really, really beating. And keep in mind, I've been having like lots of heart palpitations by this point, like as soon as I had been like upping the domperidone. So I hung up. And I ended up like sitting there, like just like finding some place to sit. And I was like, oh my God, I'm just gonna like pass out. Like I feel like I need to crawl up on the floor because I was so weak. Like I could barely keep myself like sitting upright. So I called 911 because I didn't know what else to do. I definitely couldn't go back to work. And then I couldn't even really talk to them on the phone because like my whole tongue and my jaw and my throat were just like spasming, and then my diaphragm started too, so it was hard to breathe. Like it was just having these weird muscle spasms, and I had actually been having these diaphragm muscle spasms a number of times away from any of the other symptoms. Like I've been having just this weird, all of a sudden, trouble breathing in my chest, just sort of like this, and jerking motions, and I had no idea what was going on. So now I was having all of these symptoms together in this really weird attack of some kind. And I ended up going to the hospital. I didn't get checked properly. I had some like really arrogant young intern who like was just arguing with me about like why I was even there. And I was trying to express myself, like what was going on. But like by this point, things had calmed down, but I was so exhausted. Like I was just completely depleted of my energy. I was even having trouble like talking and expressing myself. So I ended up being released. She wrote down in my chart that it was like psychiatric, which was like a huge piss off. So none of it was properly investigated, and I was just sent home. And after that, I just couldn't really go back to work. I was also having some really bad problems with my pancreas at the time too. So it was just too much, and I just couldn't go back. In the back of my mind, I was wondering if this had to do with the domperidone, because there's a black box warning for sudden cardiac arrest. and I was having some chest pain and palpitations and trouble breathing and all the other stuff that I'm mentioning. I had actually had an episode about, I would say, 6 months to 8 months before that, where I thought I was actually having a full-on heart attack because I was having sharp pain into my jaw, down into my arm, and into my chest, going right through. And it actually felt like somebody was squeezing my heart, like grabbed my heart and was like squeezing it as hard as they could. And I couldn't breathe. And that actually, like, and I was sweating and I was like super fatigued. And this actually went on for like, I don't know, quite a few hours. And for like 3 days around that time, I was feeling super unwell. But I actually didn't go get that checked out. So I have no idea what actually happened. Anyway, let's talk about the recent episode that we were originally talking about. So I ended up stopping the domperidone after I got home from the hospital, from the ER that day, just because, not just like randomly stopping, just like taking like 1, I would say, or 2 a day, because I wasn't eating because of my pancreatitis. So that was just sort of like, because I was going through that. It wasn't because I thought it was the domperidone for sure and then I would stop, because like if I wasn't taking the domperidone, I was like, how am I even going to eat at all anymore? So just by default, I had basically stopped the domperidone cold turkey, or almost stopped it cold turkey. And when I did that, I ended up going through this really severe anxiety and depression, and it just kind of like came out of nowhere. And later on, I found out that you really have to taper domperidone. You can't just stop it. Like, you're supposed to taper it slowly over time. Like, at least down, like, I think it's 10 milligrams every 2 weeks. That's what the pharmacist had told me. And even then, it may cause some withdrawal symptoms. And some of the withdrawal symptoms are anxiety, depression, and in rare cases, psychosis. And I do mean severe anxiety and depression as a withdrawal symptom. So I'll just read to you guys what it says online about domperidone as the main sort of reason why domperidone is usually not prescribed, or it's very carefully prescribed, and why you need to get monitored continuously when you're on domperidone. This is from Wikipedia. Domperidone use is associated with an increased risk of sudden cardiac death, most likely through its prolonging effect of the cardiac QT interval and ventricle arrhythmias. Now, I know this is from Wikipedia, but my GI did tell me that this is something we need to monitor as your heart, because it does carry a risk of sudden cardiac arrest. What it can do as well is just kind of mess with the heart rhythm over time, and that can also be a permanent problem. So I know I said that I stopped my domperidone, or like very greatly went down on my domperidone because of the pancreatic attack, but then I ended up upping it again to about 4 a day once I started eating again, especially to put on weight from the pancreatic attack, because I dropped from 100 and I think it was like 15 pounds, and then I ended up dropping down to 96. So once I got back on the domperidone, I kept on it for about like 6 months or so. And just to let you guys know, my dose itself on the 4 a day was 40 milligrams. So that's not even the highest that you can go. Women who take it who are lactating, I think they go up to something like 80 milligrams a day. Then all of a sudden, out of nowhere, one day, my tongue started to pulsate. Just like started to pulsate, and it never stopped. And I kind of noticed this weird feeling in my tongue, and I was just like, what the hell? And then I looked in the mirror and I was like, wow, my tongue is moving on its own, which it's doing right now, which you can't see because I'm talking. Okay, so this is the weird tongue thing that's been happening. And I swear I'm not actually doing this on purpose. It's just doing it on its own. And sometimes it's quicker and more rapid and moving a lot more and actually hurts. And sometimes it's like what's happening right now. I do have control over my tongue, but I don't have control over the constant pulsating, which still to this day has not stopped. So I called the pharmacy and I went over all of my medications to see if any of these could be causing the symptoms that I was having. The pharmacist told me that the domperidone could be causing tardive dyskinesia. I started to research tardive dyskinesia and it didn't feel like it fit. But then I found tardive dystonia and I felt like that did fit. Tardive means late onset and dystonia means uncontrollable movement. Both tardive dyskinesia and tardive dystonia can happen after a long time of being on a medication and can also continue after you've stopped and can be permanent. So dystonia can end up becoming worse over time. I think it said online something like over the course of 5 years. This was from a dystonia organization. I started to find some medical articles that actually pointed to domperidone causing both tardive dyskinesia and tardive dystonia. And also dystonia and dyskinesia without the tardive part. When it's late onset, it means that it can sort of come on like progressively. It can come on years after taking the drug, at any point after taking the drug. This is true for antipsychotics as well, because they're dopamine antagonists, just like domperidone. So it does make sense that domperidone would cause this. Domperidone is least likely to cause tardive dystonia or dyskinesia. It's not impossible, but it's less likely than things like Reglan, which is more known for its ability to cause things like tremors. My doctors told me that domperidone was a safer choice because it doesn't cross the blood-brain barrier. However, this isn't entirely true. It does cross the blood-brain barrier to some degree. It just depends on the person. I know that in the elderly, it's far more common to develop things like dystonia and dyskinesia and things like that from medication because of that tissue degradation. I came across a few people suggesting that domperidone can cause psychosis. I started to look into it, and I did find some information on that online through some medical journals as well. This is a pretty rare circumstance that it would cause that. And of course, we don't really know, did this person have a genetic predisposition to psychosis, or was it something that it was multifactorial, including the withdrawal of domperidone, et cetera, et cetera. So it's just something that I came across happening to a couple of patients as a withdrawal effect of domperidone. I did check with my pharmacist, and she did say that yes, domperidone can cause anxiety, depression, and even psychosis when you're coming off the drug, even if you taper slowly. I guess this is attributed to the fact that it's been messing with your dopamine receptors. Now, domperidone does affect your pituitary functioning, or it can affect your pituitary functioning. I did come across some people online, quite a few people actually, who did share their experience of domperidone causing a pituitary tumor. Pituitary tumors are actually quite common just in general in the general population. I just want to note that because that's something that I came across. I think it's worthy of mentioning here since I'm, sort of blaming domperidone for causing pituitary tumors. But there is literature out there that does state that domperidone can potentially cause pituitary tumors and dysfunction. So as of August 2020, the FDA has not approved domperidone for use in the general population due to cardiac arrhythmias, cardiac arrest, and sudden death. However, there's one little but though. There's something called an investigational new drug application. This is something that your doctor in the US can fill out and send over to, I believe it's the FDA. You would have had to try other treatments, and it would have to be something like gastroparesis that you're asking the domperidone for. I think you'd have to basically fail every drug treatment in order to get the domperidone. It's also really important to note that if you're on something like erythromycin, it can actually increase the risk of sudden cardiac issues or cardiac problems. So you guys might be wondering what I'm doing right now for my gastroparesis. Well, I'm just basically eating tiny little bits of food every hour, which is something that they recommend for gastroparesis if it's severe enough. I have pureed food, shakes, soups. That's mostly what I eat. I try not to eat anything solid, as at this point, solid food doesn't really move through my stomach very well. I'm doing a gastric emptying test finally. I think it's coming up actually this month. Actually, it's tomorrow. I'm doing my test tomorrow, and I forgot somehow that I'm doing a 5-hour gastric emptying test. So I guess we'll see what my results are. I'm talking with a GI who specializes in motility about all of this. There's really just one more drug that she does want to try me on, and that's prucalopride. I've been researching this drug, and I am absolutely terrified of all motility drugs at this point. But the only other options here in Canada, not in the US, you guys have so much more. But in Canada, we basically would have pelvic Botox, not pelvic, sorry. What am I talking about? We have pyloric Botox. So that would be Botox going into the pyloric sphincter. And then that's really only a 50-50% chance of working. And you also have to meet certain criteria in your gastric emptying test in order to even get it. And then we do have a procedure here. I want to say it's the POP procedure, but I'm not positive. It is where they cut the sphincter. It's something that I'm pretty sure I don't qualify for because I have EDS, but I have to double check. But also it's a pretty risky surgery, so I really don't know if I would be a candidate for that. And then other than that would be a feeding tube. This is after trying all of the motility drugs. But because I'm having dystonia, regardless of whether it came from the domperidone or not, as we don't totally know, it doesn't matter, because now that I have the dystonia and the dyskinesia type of symptoms, I don't really qualify to try things like Reglan anymore, because it's kind of a given that I'm going to like neurologically freak out. So yeah, those are sort of my options now, and I'm kind of waiting to see what's going to happen. If I did get a feeding tube, it would be a GJ tube, where they would put an incision into my stomach and then feed a line down into the intestines. Obviously, this is something that's super terrifying, but I am really malnourished to the point where I'm going to be needing iron infusions soon, and I'm going to an IV clinic to get hydration because I cannot eat and drink at the same time, and I'm not getting enough fluid in with the shakes and the soup, even though it's fluid, and you would think I would get enough fluid, but I'm just not getting enough fluid. So all in all, domperidone was amazing and wonderful and life-changing and helped me actually live my life when I was taking it, which was so awesome. But now that I can't take it, it really, really, really sucks. It's interesting that the FDA doesn't approve domperidone, because there are so many drugs that are approved in the US that would so tremendously help people like me that is not available in Canada. And yet domperidone is approved. And this is sort of the huge conundrum that a lot of us in Canada have, is that there's so many drugs and treatments like gastric stimulators that we do not have access to here in Canada that you guys over in the States have tons of access to. So whether your doctor has it or not, or even your state, we don't even have that as an option. We can't even hop over to another province and go get those treatments because they just don't exist. So that's something that I'm going to talk about actually in another video, because I really want to break down the differences between Canadian and US healthcare and actually throw in UK's healthcare when I start learning a little bit more about it, because I think it's really interesting to understand, especially for other spoonies to understand. Other people with chronic illness, if you don't know spoon theory. I think it's really important for people to understand the differences in healthcare, because it really does affect us, and it affects our interactions, and it affects our political decisions, and it affects our daily lives. So that is my experience on domperidone. I hope that you enjoyed this video. I hope you derived something out of it. I hope that it was a really interesting video for you, and you learned more about this drug, whether you're on it or thinking about it. And I hope that you join me next time. Please like and subscribe if you enjoyed this. Please comment below with your tips on gastroparesis, as I could really use them right now. Take care until next time.